for a long, long time. However, the COVID-19, the coronavirus pandemic, just had us really, really have to spring into action. And one of the reasons is because the Harlem and urban communities are really not being covered by the major media. They're not getting the full information. And initially, when all of this started, there were many people in the community that were walking around and they were like, I'm Black, I can't get it. And some of that had to do with what they saw on major media, the fact that they weren't seeing themselves, so they didn't really have an idea of what was going on. So it's very, very important that we're here to really inform the community. There are also some community members that have really lost faith in media, lost faith in the country, so they really don't participate. So we have just brought this together so that we could really share and make sure that people are informed. Knowledge is power, and also being a community media platform, we're here, we know what's going on, people know us, so therefore there is trust. And that is a very significant thing, particularly in Black and Brown communities. And as you know, our communities have been hit the hardest by this COVID-19 for many, 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 many reasons. Last week, we had the honor to have on all of our public officials for a town meeting. And that town meeting actually began with Dr. Malanga Karenga, who is the founder of Kwanzaa. So that was really amazing to hear what he had to say. And one of the most significant things that he did say is that we are African people. We are different, and it's okay. We are uniquely different. We're all human, but there are things that are unique about us as an African people. And the other point that he made, which I thought was extremely significant, was that we are struggling against two viruses. We're struggling against the coronavirus and the pandemic, but we're also struggling against the pathology of racism. And that's extremely significant because everything that has happened has really brought to the spotlight the racial disparities in this country and in the world, and how people are suffering because of it. So without further ado, I want to bring to you our Harlem doctors that are here with me. I have Dr. Michelle Alexander, and she will be our co-host here. So this way, you know, she can talk through a lot of the medical terminology and make it clearer, which is great. And Dr. Michelle Alexander is formerly the Director of Medicine for Con Edison. And prior to that, I believe the Vice President of Medicine for Transit. So Dr. Michelle Alexander has experienced what the pandemics have been in New York City from a 911 perspective, as well as from a Hurricane Sandy perspective. And I'm going to go to Dr. Michelle Alexander, but one of the thoughts that just came to me is the fact that we're experiencing this pandemic now, but as people of color, we pretty much have experienced a pandemic, 400 years of pandemic. We've always had to struggle. We are always dealing with all of the disparities. And now, on top of everything else that we're dealing with, it's the COVID virus. So Dr. Michelle, welcome and thank you. And we also have, before I go to Dr. Michelle, we also have with us Dr. Leon Merrick, who is one of our Harlem doctors. We have Dr. Icilma Fergus, who is Director of Cardiology and Disparities in Cardiology. She'll explain further. And we have Dr. Henry MxCurtis with us, who is a Harlem psychiatrist who was head of psychiatry at Harlem Hospital for a long time and is in private practice. So these are people, excuse me, that are from our community. They are members, excuse me, they're members of organizations. Dr. Alexander Dr. Merrick and Dr. McCurtis are all on the ministry, the health ministry at the Abyssinian Baptist Church. So they're very, very active in the community. Dr. Fergus has Harlem Healthy Hearts and is very engaged. She's a member of the AKA sorority, as is Dr. Michelle Alexander, and I think I'm correct. So, and also Dr. Fergus is the vice president of Jack and Jill, which is another one of our community organizations. So these are doctors, but these are people that are actually boots on the ground and interact with the community and are part of the community. And that really is significant. So thank you, Dr. Michelle. Can get started.
So hello, everyone. I just wanted to thank you, Terri, for getting this together for us today, because I think this is something that's very much needed in our community. It's needed to hear from doctors within the community who have children and parents and loved ones that are part of the community. So it's part of the way that we need to disperse information and to give and disperse misinformation, and also to make sure that our community is responded to appropriately. We know that with this particular pandemic, that our community has been the hardest hit. Black and brown communities, and in particular the Black community, has been hurt in terms of we have had much more people who have actually been exposed and have the coronavirus, and then subsequent to that, all the consequences of the coronavirus in terms of deaths. We have suffered somewhere between, they say, 4 to 5 times the number of deaths as the white community in the US. So I'm going to give a little background on coronavirus, or the novel coronavirus, as it is called today. Yeah, it is a virus that was discovered in Wuhan, China in December of 2019. And that, when it was discovered, it is said that it came from a market in Wuhan, China. It came possibly from bats. There is some discussion about whether or not that occurred, but it is believed that it was animal to human transmission at that time. But since December of 2019, it has been totally human to human transmission. The virus is called SARS-CoV-2, and that is the virus that actually has caused COVID-19. And the reason why it's called COVID-19 is that the disease, or the outcome of that virus, started in 2019. So the outbreak occurred in Wuhan, China, and it quickly went around the world. It went to a number of places, including the US, but Europe, and it's basically in all parts of the world. There are very few places in the world that have not experienced the disease outbreak or the virus, but it seems as if the places where people travel very little, or get people coming into the country very little, are the places that have seen the least amount of the disease. So we know that the virus spreads by respiratory droplets. There is very good evidence that these respiratory droplets basically, you do not have an aerosol, meaning that it's not sprayed into the air, although you can transfer, or the virus can be transmitted from person to person by speaking, by coughing, by sneezing. And this is the reason for the social isolation of 6 feet, meaning that you should stay at least 6 feet away from people who you have no contact with, or because this is a virus that basically is spread by close contact. And of course, it is for that very reason that within the Black community, where many of us live very close together, we have multiple generations of families living together. We have multiple people living together, all in the same place, living closely together. This is the reason why we're seeing the numbers of people who have contracted the disease. We also know that Black people are the people that provide the services generally in our community. They are the train operators, the bus operators, the grocery store workers, the essential workers, all the people who do our deliveries, the people that up until this time were not seen as essential are now seen as essential. And we also know that based upon what we've seen, that that people have, it is for that reason that we have seen much more exposure in the Black community, because we know that when we have people that are in close quarters, like the trains, like the buses, that you have a greater risk of transmitting the virus to someone else or getting it from someone. We also know that the virus does not necessarily cause symptoms. And 80% of people who are exposed to the virus, they have mild symptoms or moderate symptoms, or they may have no symptoms at all, or which is among the medical community, we say asymptomatic, meaning that they have no symptoms. But for a large group of people, generally people who are older, and most of the information says that over the age of 60, you're much more likely to have symptoms, and then to have symptoms that are very much more severe. So I'm going to talk about what those symptoms are. We initially talked about fever, chills, malaise, meaning fatigue or just feeling achy and tired, and the more severe symptoms, those symptoms of shortness of breath and difficulty breathing. That is the symptom that is most worrisome when the recommendations are to really seek help. But we have also noticed and that has been reported lately, that the symptom of loss of taste and loss of smell is also a finding, along with blood clots or strokes in certain people. And we've noticed that this is a finding that has particularly affected the Black community. People that are most susceptible are people who have immune systems that are compromised, meaning that they're not as, they don't behave as a normal immune system. And those people are people that are older, people who have underlying lung disease such as asthma or chronic lung disease from smoking, cigarette smoking, or even smoking other things. We also know that people with heart disease and diabetes and obesity have an increased risk for having more serious consequences of the coronavirus. So when we look at this disease, it has been a disease that has exposed the disparities of within the Black community, the systematic disparities that existed long before coronavirus came into being. There's someone has a phone or is on the phone?
Not muted. The phone's not, someone is not muted.
Yeah, somebody's not muted and you can
hear. Just a moment. Hello. Yeah, someone is not muted. It may be me. Thank you. Okay, I'm sorry. I'm on the call. I can hear everybody. I apologize. Thank you.
All right, because it's coming through and it's
distracting. Okay, great. Okay, I'm so sorry.
Yeah,
continue, Dr. Michelle. Thank you.
So because of systemic racism in this country, we have seen Black and brown people, Black people in particular, being more adversely affected. You know, poor access to to quality health care, the fact that many people get turned away at a hospital even though they should not be, you know, there. In fact, I wanted to talk about some of the things that should automatically happen. You should never be turned away from the hospital for your inability to pay. And that is something that we need to say to people over and over again, that, and you should not be afraid to go to the hospital if you need care. That is key to getting, in order so that you can be, your life can be saved. If it's necessary for you to go to the hospital, you should not hesitate to go. And we know, and I'm going to ask Dr. Fergus to talk about this, that some people have actually delayed going to the hospital who have serious heart problems because of their fear for catching COVID. So there are mechanisms in which people should observe when they do think that they need to go to the hospital. At some point in time, we should talk about testing, what the different types of testing are, but I don't want to spend all of my time talking, and I really would like to go to Dr. Fergus at this time, who has been boots on the ground, actually seeing people in the hospital on a regular basis. And I would like to hear from her as what her experience has been regarding the coronavirus pandemic. Dr. Fergus?
Can you hear me? I just unmuted. Can you hear me?
Yes, we can hear you, Dr. Fergus.
Yes.
And, thank you so much.
Yes, thank you. First, let me say thank you to the Harlem Networks for inviting me to be part of such an important and interesting forum. You know, I'm delighted to be here and help to shed some light on some of the things that we know. I think Dr. Michelle Alexander has already given a very broad overview. Sometimes people have to hear things a couple of times for it to really sink in. But I will say that there's a lot that is going on, a lot that we don't know, and I'm living it every day. So you ask about my practice and what I have experienced. I've actually been on the COVID front lines. I, deployed as one of several physicians who had to leave their normal practice and go out into the field to take care of all these people. Hospitals were converted into mainly COVID units as people dealt with the issues and ramifications of such an illness. You pointed out that 80% of people either have mild, moderate disease or asymptomatic, but of the 20% that actually are significantly symptomatic, it could be particularly devastating. And as you point out, particularly devastating for Black and Brown communities. You also talked about underlying conditions. And if I could tell you, more than 1 in 2 African Americans have hypertension over the age of 50, okay? And when you look back at Wuhan, China, 70% of those who had very critical illnesses or succumbed to the disease had hypertension. So we already have a disparity in this country with Black and Brown people with hypertension. Also diabetes, you pointed out obesity, physical inactivity, lung disease, and all of this, absolutely correlates to heart disease. In fact, very early in this pandemic, you also pointed out that some people were turned away from the hospital. Well, I had a patient who succumbed, one of my patients who I had been following for quite some time, and she did have underlying heart disease, but she also had hypertension and prediabetes, and her symptoms were atypical. So I do want to point out that we listed all of the particular symptoms, but some people may present atypically. You talked about loss of taste or smell, anosmia, hyposmia. Another symptom is people may have headaches or they may have GI discomfort. So this virus attacks all of the organs in the body. And, and this patient presented initially very early on. She had that metallic funny taste in her mouth. She had GI symptoms in particular, and she did have a fever, but she was turned away from the emergency room, sent back home, and she reached out to me by text. And this was early in March, okay? And she said, you know what, I just don't feel better. She said, I can't even make it from my bedroom to the bathroom. I'm very weak. but she was complaining, she was not coughing. And I say this to say that people may have different symptoms, but if you're feeling symptoms that are out of the ordinary, overwhelming, and you have a fever, go get checked out. I had her go back to the emergency room. In the emergency room, by that time, she began to get a cough. And they subsequently admitted her for COVID pneumonia because it attacks the lungs. And you know, that's like sort of the main organ that it goes for when it finally sets in, and ends up causing what's called an ARDS-like picture. This is what people end up dying from. What that is basically the lungs stop functioning as they should. You pointed out about clots. So yes, we also know that there's a quote hypercoagulable state where people have a lot of clots. And as you know, the cardiovascular system is, you know, based on, you know, being able to have blood be delivered to all the organs because it delivers oxygen, nutrients, etc. So if there are clots all over the body, then you'll have, you pointed out, strokes, you can have heart attacks, the lungs go down, the kidneys, all of the organs. Early on in you know, this presentation, this wasn't known. So probably a lot of people who succumb to heart attack, pulmonary emboli, etc., they may have had clots. But as they kept doing autopsies, and as they kept doing different studies like CT scans, carotid Dopplers, and other testing, and also blood testing, they found out that people had a very high level of clotting, and that's a major deal. So one of the treatment mechanisms that has been developed is an algorithm to treat, you know, clotting, starting with intravenous heparin, low molecular weight heparin, and people go home on oral anticoagulants. So that definitely is one that has been studied, you know, and shown to work. I don't know if you want me to come back to treatments. I could come back to that, but I think
we should talk. I think we can talk about treatments a little bit later because I do want to talk to Dr. MxCurtis, who's going to give us the mental health part of this. And I also want to talk about.
I actually wanted to go.
Oh.
Go ahead. I wanted to hear her.
Okay. Well, I had a question. I mean, this is raising so much information that's so vital, but are the symptoms in people of color different than other communities? Because I understand, as you're saying, there are many, many different symptoms, but that's a question. Would a person, a brown or a black person, have different symptoms than a person of another race based on the fact of, well, there are different conditions that they might have?
I mean, I could say personally, I've taken care of probably over 75 different people right now, including those that I saw on the front line, and I've seen black, brown, you know, white, different male, female, and it varies from person to person. But the one thing I could tell you is that we already know if someone, let's say, has diabetes, right? Their nerve endings are different. They have, you know, neuropathic, you know, conditions, so they may experience things a little bit differently. So let's say they were having or about to have a heart attack from the COVID. They may not experience a typical chest pain that one would experience. So, and again, the black and brown communities are more likely to have the diabetes and the hypertension. So in that sense of, you know, devastating types of symptoms that may be deadly, they may not feel it that way. But in terms of the presentation, almost every person that I spoke to presented a little bit differently. Some has the shortness of breath, the cough, others it may be a headache, others it may be a fever, others it may be backache or stomach ache, but simply, and I think Dr. Michelle actually said this nicely as well, if you have these symptoms, the constellation of symptoms, one that is definitely pervasive throughout everything is having a fever. But if you feel that you are not, you know, yourself and you're very symptomatic, then you should go out and try to get some help, because Dr. Michelle stated this. People waited. Some of the deaths may have been prevented if people had gone out earlier. People were afraid to go into the hospitals. Now, not every case will go into the hospital, and they do point out when should you go to the hospital. So I'll tell you right now, if you feel chest pain, and if it potentially could be in the heart, you need to be seen. If you are short of breath, you need to be seen. If you have, and a lot of people now have these pulse oximeters that measure your oxygen. If your oxygen is 90% or below, you need to be seen, okay? If you have a persistent fever that keeps on being elevated despite you're taking, Tylenol or something, these are things you need to go in and be seen for, because if not, it could be a detrimental outcome.
Dr.
Okay, and that goes to a gender situation. Is it different in men, different in women? Excuse me, we've heard different things about fibrosis of the kidneys, fibrosis of the testicles. I mean, are these part of some of the things that happen as a result?
One of the things, Terry, that I can tell you that, at least from all of my reading, is that for many Black patients, because of the health disparities that we have walking into the room, basically, because of the hypertension, because of the diabetes, because of the underlying health conditions that we already have, there is sometimes different presentations. One of the things that my understanding from speaking with quite a few nurses is that for many Black men, they don't necessarily always have the cough, nor may they have the fever, but they may many times have what we call general malaise and myalgias, where they have achy, they are feeling really out of sorts, they have pain. And my understanding is that because of the underlying hypertension and the underlying problems with their heart, many of them, those are the ones that are very predisposed to the hypercoagulability and the clotting. And so sometimes they may present initially almost as if they had a stroke or like they were having a stroke at the time. They may have symptoms of confusion, an inability to stay awake. They may have sudden facial drooping. They can have numbness in their face, their arm, their leg. They can even have seizures. I have a very, very good friend of mine who her loved one, her ex, literally had a seizure in the middle of the street. And it turns out that he has COVID-19. And that was his initial presentation. There's the other thing that's unusual is uncontrolled bleeding. We already talked about hypercoagulability, which means that you have an increased risk for clotting. But there are some people that actually have bleeding as their sign, and their bleeding is occurring in the brain. And so it's presenting like a stroke, and it is a stroke. They also, one of the other things that I think is unusual for some people is that some people have severe or persistent vomiting and diarrhea, which Dr. Fergus already pointed out. You know, you can have gastrointestinal symptoms, meaning symptoms that comes from your gut. And that is not a usual thing that we think of when we think of a virus like COVID, because we were told, at least initially, that this was fever, cough, and shortness of breath. Now we're seeing many more different symptoms now that it's outside of China. And I just, I think that a lot of the studies that initially came out were among the Chinese people, because that's where it first occurred. And now that we're seeing it in a more diverse population, meaning among Black and brown people, we're getting a completely different picture because it's being seen in Black and brown people. And so the things that are being reported, or at least the initial things that we saw were reported, aren't not true. It's just that we're seeing changes because of who we're seeing it in. And I would be remiss without talking about some of the things to do that we should have been doing, or you should do long before this disease came along, which is about trying to stay healthy and doing things that are in your best interest as far as your health. And we can talk about that. I know I heard someone else that wanted to come on, so I don't want to take up too much more time.
Okay, Dr. Fergus, did you want to address? No, and then I just want to let everyone know, and we're going to go to Dr. Fergus. I do have several questions here. So once Dr. Fergus addresses her issue based on what Dr. Michelle had said, we're going to just take a few questions because they're pertinent to what we're talking about. So thank you. Thank you.
I think I just want to support what Dr. Michelle Alexander said. And just say that the coronaviruses have been around forever. They've been known to cause a lot of like human diseases, typically the common cold or other things. So this particular coronavirus, I think from what we can gather, is that it affects every possible organ. So because of that, you're gonna have, you know, symptoms that may involve all of the different organs, as Dr. Michelle Alexander just pointed out. So it's not just a respiratory, apparently not just a respiratory virus, but you know, because the fact that it's causing a hypercoagulable state, and because it's causing a massive inflammation and immune response, is also affecting other organs such as your stomach, your GI system, your kidneys or your renal system, your brain or your cerebrovascular system, your heart and your lungs. So all of the major organs can be affected. And I think the point we're making is that just don't assume that these symptoms of the typical symptoms of shortness of breath, fever, and cough are the cardinal symptoms, because as Dr. Michelle Alexander pointed out, though some of that initial data came from people who are not Black and brown, now we're dealing with people here in the United States who already have underlying conditions that, you know, amplify, you know, what's already there. And so, and we're also learning about new conditions as time goes by. So we're both saying that if you're finding out that you have symptoms that are persistent, unusual, severe, pay attention to them, because just don't think that you need to wait for a cough, right, and shortness of breath, because that may not necessarily be your trigger for the COVID-19.
Okay, thank you, Dr. Fergus. One other question, because I know there's so many questions, and we certainly will have to have you all back again. But one of the things, where are we? Because in the main news, we're hearing a lot of things like we're at the peak and we're, you know, at the top of the curve, and then there are going to be losses at the bottom of the curve. So at your facility where you are on the front line, and what are you seeing? Are you seeing less people coming in? Are you seeing less people passing away? Where are we in this process? And that's a very loaded question that I'm, you know, sure is broad, okay, but if you could just share a bit, and then we're going to go to the questions. Thank you.
Sure. I can say that definitely there's a trend down. We're on the other side of the peak, so to speak. We had thousands of people admitted. We had thousands of people under investigation called PUIs. So we have seen a decrease in the amount of people who are hospitalized each day. We've seen a decrease in people coming into the emergency room. We have seen a decrease in mortality rates or death. However, it's still ongoing. But what we're seeing is a lot of patients who have recovered from very significant or severe symptoms, but they have now a lot of chronic ongoing symptoms. So I'm seeing people with persistent shortness of breath, and they may have pulmonary fibrosis or lung fibrosis, as we talked about before. And because of the huge inflammatory process on the body, we're seeing, you know, residual kidney, renal insufficiency or kidney insufficiency, as well as liver and heart. In fact, there are people who I'm going to be sending to the cath lab who came out of the hospital and they're now having chest pain because of possibly an inflammatory process. But to your point, we're cleaning up. We've had a lot of the floors that are now becoming non-COVID, and there has to be a systematic approach at getting some of the routine testing back for, you know, for the heart, you know, and for other things as well. So there's a systematic approach which will continue to maintain social distancing. I know the plan is for our institution is to have all of the employees tested and to have patients tested when they come in, so that we maintain the sanity and the cleanliness of a particular, you know, location, that, you know, that there are areas that are designated, quote, clean areas, that patients don't need to be afraid of coming in because they're going to be seen and taken care of without being, you know, being afraid to come down with COVID. And we also have the telehealth. So I could come back to that later, but there are numerous patients that are seen by telehealth, which is video visit or phone calls, because at this point with the social distancing, we don't want overcrowded waiting rooms. We have reduced the waiting room to where there are only 20 people in the waiting room, and they're physically distanced, and they're not spending time in there, because you may have heard 10 minutes or more with this virus increases the amount of inoculum, or the amount of virus that can come into you. So you want to minimize having a lot of people in a small space. So all of those are the things we're doing to gradually try to get back to normalcy in terms of
you.
Dr. Fergus, when they do go to the emergency room, are they supposed to wear, or does the hospital provide some kind of face covering or mask in the event that they do not have it?
Yeah, there's face covering that's provided, but I would recommend that everyone continue to wear masks. Now, as you pointed out before, there are droplets that come out when someone speaks, and they did an experiment in the lab showing someone speaking with and without the mask, and you basically see a spray coming out in the saliva that goes several feet out, which is where they got 6 feet. But if you wear the mask and you know, there's less of a spray coming out, very minimal. Yes. So they encourage people to, when they come in, to wear a mask, and if not, they try to provide that.
Okay, I mean, I think that's, all of these are very, very valid points. I'm going to move to some of the community questions, because I want to make sure that we get our questions in, and then we get to, for those of you who just came in, this is Harlem Network News. I'm Terri Wisdom, and we have Dr. Michelle Alexander here with us, as well as Dr. Fergus. And we also have Dr. Merrick, and we have Dr. Henry MxCurtis with us. So moving to the community questions, we can't say enough that we've got to protect ourselves. Wear the mask. At this point, masks are cool, so let's wear our mask. I was outside yesterday here in Harlem, and I just saw a lot of people without masks, and I just thought, okay, you know, you got to protect yourself, you got to protect other people. We don't know what's happening. So we have a question from Janae Shabazz, and she is the owner of Sugar Babies, which is one of our wonderful, well-known childcare centers. And she closed her center down on March 15th, and she is considering reopening her center as an essential service. She's right on 138th across from the Abyssinia Baptist Church. So she's near to Harlem Hospital. So it would be wonderful for those Harlem Hospital workers' children to be able to come. But she's just wondering what she might have to do to open back up. And then she also is asking the question, are the symptoms in children different in the symptoms in adults? So I think that's a good question. Okay. Dr. Fergus? Alexander.
That's Alexander.
I'm not a pediatrician, but I know that the number of children who have had significant findings, or should I say symptoms from coronavirus or COVID-19 is very much reduced under the age of 20. I think that it wasn't until last week that a 5-year-old had a reported death as a result of COVID-19, and that was the parents were both essential workers. The mother was a police officer, and then the father was a fireman, and incidentally, it was a young 5-year-old black young girl who was a beautiful little girl. My understanding is that it is largely based on the fact that children's immune system is much more robust than someone who is older, and the way that they respond to the virus does not have the same and part of what I at least read from the pediatricians is that in many instances when you're older, you over respond, your immune response is greater than sometimes than necessary, and it's that over response that starts the destruction within the lungs. And for many young people, that does not occur, so that the virus does not get into the lungs, first of all, because of the robust response that children or young people have. And that's one of the reasons why many people who are younger have no symptoms. It does not mean they're less infectious, though. So they still have the propensity to have infection. But when that does not mean that young people do not get very, very ill. And I just want to just point out that there are a number of cases among young people who have gotten very ill. They may not have died, but they've had very terrible consequences. Dr. Fergus has already pointed out that when the virus gets into the organs like your heart or your lung or your gastrointestinal system, it causes scarring, fibrosis. So that means you can have long-term effects from having the virus. So some of these younger people, even though they may have recovered, they may end up with long-term chronic diseases directly related to the virus and because of how the virus attacked those systems. Okay. So that's what I've read.
Okay, thank you. And so I guess we've given some factoids, and Janae Shabazz of Sugar Babies, we can speak with you after, because I think she's just trying to make a decision as to what the best course is, what the safest course is, and of course, concern about the parents and the children. We're going to move on because there is so much, and this is just a wealth of material, and just the fact that the community is able to listen and get information from the community doctors is significant. But we're going to move to Dr. Henry McCurtis, and Dr. McCurtis is a psychiatrist. He also does psychoanalysis, and he has a specialty in addiction. So without further ado, and he's one of our major psychiatrists here in the community, and he changes the playing field, because I know for many years, a lot of people of color were very leery about going to a psychiatrist. They felt maybe the person couldn't understand them or whatever, but Dr. McCurtis is just amazing, okay? If you need help, Dr. McCurtis can help you, that's for sure. And he has a very, very keen understanding of the Black and brown conditions in this country, which impact everything. They impact your psychological effect. So thank you, Dr. McCurtis. Thank you for sharing.
Well, thank you for allowing me this opportunity to be a part of this, I guess, historic form of communication in Harlem. We owe it to your creativity, and they say that crisis results in our responding with ingenuity. You certainly have, and I appreciate the opportunity to participate. I was just enthralled by the information given by Dr. Fergus and Dr. Alexander. And you mentioned at the beginning the power of information. And that also means the power of disinformation, misinformation, lack of information, and even propaganda. So what you're doing, I'm sorry, this thing keeps falling.
Okay, thank you.
What you're doing is extremely important for our mental health. What we know, what we believe affects how we feel and how we behave. So you are providing a social therapy, if you will, by making an effort to provide us with accurate, timely, and socially and culturally syntonic information. Once again, thank you so much.
Thank you.
I want to talk a bit about the impact of COVID-19 on a common experience that we have from birth to death. and that is loss. The COVID pandemic has reset the world. It has caused all of us to experience loss.
I don't know.
And the loss is pervasive. It may be something as simple as the loss of our usual routine, what we do every day. That's changed with the stay in place, shelter in place. That's a loss. Knowing what to do with yourself every day, having to adjust and finding how important it is to have a routine. The loss of a job, and consequently the ability to provide for basic needs, food, clothing, shelter, safety, and security. And God forbid, if you already were experiencing stressors in being able to provide for those basic needs. One symptomatic picture of this was looking at the subways becoming auxiliary shelters for people, and consequently enhancing the transmission risk because of them being housed in these close quarters. So loss is pervasive throughout this, in addition to the symptoms that Drs. Ferguson and Alexander described. This array of physical symptoms and loss of function, loss of physical health, loss of job, loss of routine, and then the loss of loved ones. So the experience of losing, being deprived of something of value, of habit, and being deprived of someone we love, these are situations that evoke grief in us. This very unnatural situation, well, I shouldn't say unnatural, it is a natural situation, and it's producing an abnormal crisis. And we are responding normally to this crisis. And I want us to be aware that our reactions are normal. We have to realize that this is producing an overlay to all of our usual experiences. But grief is something that I think it's worth our looking at and understanding some of its symptoms, because interestingly enough, a lot of the symptoms, some of the symptoms may even blend and confuse the experience of the virus. I will describe. First and foremost, we see it in the social psychology, and we see it on a local basis and an interpersonal basis. The anger and irritability, whether it's anger toward the press, or it's anger toward politicians, or it's politicians being angry with each other, you see the phenomena of people not being in control. And I should say one of the critical aspects of loss is the loss of control. And that's one thing that this pandemic has done. It has rendered us susceptible to the primal feelings of being powerless and helpless. These are, I say primal because from the time we are infants, we are attempting to move from a state of powerlessness and helplessness to autonomy, to gain agency. And this natural phenomena this little virus has changed all of that and has rendered us powerless because there was no treatment, there was no vaccination, we didn't know its symptoms. Listen to the symptoms that Dr. Alexander and Dr. Fergus described. This coronavirus, as Dr. Fergus said, this coronavirus has been around since early 1972, and there are 5 others, 4 others like them that don't cause this kind of problem. They call it the common cold, but this one produces that array of potentially deadly symptoms affecting every organ of the body. And so the people that we turn to, the medical profession that we turn to, has been stumped and have had to be stumped. And consequently, that powerlessness left us open to all kinds of potential risks, as was also mentioned. The misinformation about potential treatments, people jumping to get the treatment. I had a patient who demanded that the doctor give her hydrochloroquine when she developed symptoms. She wanted it, and I believe he gave it to her. This is out in California.
Wow.
This was in the first wave before we found out anything about it, but it was just being touted. And God knows this bizarre experience the other day that was so funny. It was almost, it was so bizarre, it was almost humorous. And you saw a lot of jokes on social media about it. The man coming up saying, use Clorox or bleach or something of the sort to disinfect. But people who are powerless and helpless are susceptible to all kinds of things. We will try to do anything to gain some sense of agency. That's my point. This condition rendered us powerless. Yes.
Yes. I wanted to just get like some understanding because I'm looking at some of the comments that are here, and I have a question. I have a question about our young people. I have a question just in terms of the psychological impact of people. I don't know if it's defiance possibly in deciding I'm not wearing a mask, or is it self-destructive, or and we know it also could be economic because there's price gouging on the mask and the economics. But there's one question, but what is the question or the answer for hope? Because I'm getting a question from Imani Scott saying this is a dismal picture. What else is there that we can do? So I'm just going to share. She's one of our Harlem vendors and does a lot with crystals and health. So she wants to know what's the positive side that we can do amidst everything that we're dealing with the stresses. I'm deferring to the community. Thank you.
Okay.
Yes.
Well, I apologize if I am presenting something dismal, and I agree. that it is. And that, I'm glad she raised that question, because that's exactly the experience that we are having with the powerlessness and hopelessness. And what I what I want us to do is to anchor ourselves with the serenity principle. Because when we are overwhelmed like this, when we feel powerlessness and helplessness, this is ancient wisdom. God grant me the serenity to accept the things I can't change, and the courage to change the things I can, and the wisdom to know the difference. And all of the misinformation, disinformation confuses us about what we can change and what we can't. So it's important to pay attention to the rules, follow the guidelines, wash your hands, keep your physical distance, shelter in place. When you go out, attend to what you need to attend to with precaution. Anchor yourself in whatever your higher power is. This is the time to do it. We are people of faith, and we have gone through far worse. And it has been because of our faith and our ability to get through difficult situations. And we will get through this. It's just at the initial stage of it, because of the uncertainty and the unknown, it has the potential to produce this kind of traumatic feelings of helplessness and powerlessness. But one thing about this, there is opportunity in all of this. There's opportunity for us to learn the strengths that we have that we're not using. And I tell people all the time that crisis should be an opportunity to do an inventory of one's own personal strength. And we have them based on how we were socialized. Virtues like courage, love, virtues like justice, transcendence, temperance. These are virtues that have influenced the socialization of strengths within us that we're not even aware that we have, but they influence us every day. You asked the question about why some people are not wearing their masks. Why do they engage in that, make that judgment decision? Why do they have a perspective that suggests that they believe that they're invincible, or that they are denying that anything can happen to them? Well, that's exactly it. We are endowed with mental mechanisms that protect us from negative affects or emotions like fear and guilt. One very powerful emotion is denial. And that's what we saw early on. And that's what we also see whenever there is loss that has a painful consequence. In the initial stage of grief, it's usually denial. Well, in this case, people in Florida were dancing on the beach at the early onset of this. People just the other day were protesting to be let go, to be liberated, where we can do what we want to do. Well, that's a form of denial, that anything can happen, that you don't have to follow the precautions, that your judgment is such that you feel invincible. Well, young people naturally have the capacity for a sense of invincibility. That's just the way they are. They don't have the experience to temper this fantasy of invincibility. So denial, they're more susceptible to the use of that mental mechanism of denial. What are some other things that we can do? Let's see. One thing is, it was mentioned earlier about the immune system. And how do we naturally boost our immune system? And this may seem like an oversimplification, but getting back to that idea of having a routine, you make sure you have a set bedtime, you get good sleep. If you have difficulty with sleep, and sometimes these symptoms, this stress, the anxiety, the depression that might emerge can cause problems with sleep, there are non-pharmacological ways of managing sleep. And so that's the first thing you want to do. You want to make sure you get good sleep. Sleep hygiene. Set a bedtime. There are a lot of apps that help you with sleep. There's a lot of herbal remedies that help you with sleep. Melatonin, which is what the brain produces at night naturally from the pituitary, we may at times under stress not have enough. We can boost it. You can buy it over the counter, 3 milligram tablet, one at night, 3 milligrams, or you can take up to from 6 to 9 milligrams to help you to get to sleep. 30 minutes before your set bedtime, you take it. If you wake up in the middle of the night, get up. Don't lie in bed. The bed is for sleeping. Get up, read your Bible, read something else, but protect your sleep hygiene. The other thing is your diet. Try not to eat inflammatory foods that produce inflammation, fats, trans fats, sugar, things like that. Try to protect your diet. And simple as something as sunshine. Get sunlight, get into the sun, get into nature if you can, but get sunlight and get exercise. These 4 things together that you can do, God grant me the serenity to accept the things I can't change, the courage to change the things I can. This crisis can be an opportunity to cultivate habits that not only boost your immune system, but can actually be health promoting and be wellness habits, wellness sustaining habits that you can cultivate. So that's something that we can do. From a social point of view, we say social distancing. That's a problem. It's physical distancing. Socially, we can be even more in contact with those that we love. Look at what we're doing now. We're sitting, having conversation and exchanging information between Dr. Fergus, Dr. Alexander, have shared such wonderful, informative information with us, but we're not in the same room together. We're using this wonderful invention of social media that you have pulled us together on. So call your friends, call your loved ones, stay in touch with them. Those are some things that I can suggest offhand that we can do.
Thank you, Dr. MxCurtis. I think that that is very critical, and see, we have so much to talk about, and it's wonderful for us just all to be here. I want to just take this time. We're going to go a little bit over because I'm going to make sure that we get to Dr. Merrick. However, I just wanted to say to everyone, this is Harlem Network News, and it's a new media platform that is here to bring information to our community that they're not getting from the major media. I wanted to give a special thanks to one of our donors, and that is the Osei Ruby Charitable Foundation, which has really helped us a lot to be able to stay on the air and be able to bring this great information to you. And I would encourage everybody that is listening, please go to our website and make a donation, even if it's, the website is harlemnetworknews.com. We have news every day, news stories that you wouldn't see other places. We have one of our headline stories is Dr. Maulenga Karinga, sharing his view. We also have a story about Cuban doctors going to Africa, to help and, do the healing for the people in Africa. And Cuba has some innovative ways that they're addressing this disease. So you're going to see that kind of material. We also have our international news, where we primarily are giving you the news from Africa and what's happening around the world, because I know that there's different discussions, the CDC, the World Health Organization. We bring all of that to you, and we bring up-to-date numbers and data to the best of our ability. So please go to our website. Please tell your friends. Please tell your family. This is a village, and this is us taking care of us. So any donations that you make, that will help. If you have stories that you would like to share with us, we will disseminate your information. We have also started a page, which is Harlem Angels Gone Too Soon, a salute to the ancestors. We want to know. And I am now just going to move to Dr. Leon Merrick, and he is one of our Harlem community dentists, and he's going to bring you some very specific information in that area. He's also a small business person, so he's going to bring that information as well. Dr. Merrick, thank you, thank you, thank you.
Sister Wisdom, thank you for including me in this panel of three incredible titans of information and healthcare who shared their information about the Black experience with us. I wanted to talk just a little bit about how COVID-19 has affected my business. My business is a dental office, and it's been devastated by this particular disease. It has scared all my patients away. And of course, when my patients left, so did the revenue. And I was forced to furlough my staff. But I know how important, as Dr. MxCurtis said, how important the job is. It's just not money, it's independence, it's purpose, it's identity. So to fight that, I had to apply for a PPP loan, the Paycheck Protection Plan, and hopefully I will get some money so I can reimburse them for their lost funds. This dental COVID-19 not only has affected the office, but it has affected me as a healthcare professional. What has happened is initially I was afraid of this thing. It was like an invisible killer that was killing people indiscriminately. So I had to do some research, and I found out that COVID-19, that virus, is nothing but a piece of protein surrounded by a layer of fat. I also discovered that it attacks the eyes, the nose, and the mouth. So I sat back and I thought, how can I come up with some sort of information package plan to fight this thing? So I discovered that COVID-19 hates alcohol and it hates soap. Because the layer of fat that covers this protein when it comes in contact with soap, the soap dissolves the fat off, it exposes the protein, and the protein can't survive naked in this environment. I came up with the fact that since it attacks the eyes, we can wear some sort of protective eyewear, sunglasses, something, so that if somebody coughs and sneezes and it won't hit the eyes, causing conjunctivitis or red eye or any of those things. We wear masks, so it protects our nasal passages from those kinds of attacks. And thirdly, when it comes to the mouth is one big piece of mucous membrane, a soft, shiny tissue that the virus loves to get into to get to the rest of our organs.
Wow.
So a proposal to fight that off, to protect ourselves with a fight back mentality, is to brush and floss minimum 2 to 3 times a day. And then to rinse and gargle, and I emphasize gargle, with a mouthwash that's approximately 20 to 27% alcohol, so we can get to the back of the throat that's often neglected. We get to the back of the throat and we can actually, in a sense, sanitize the back of the throat and keep us healthy and strong.
Thank you.
The next thing is, as a dentist, I violate that principle of 6 feet. I cannot work 6 feet away from my patient. Nothing gets done. So what happens is I have to actually get up close and personal with my patients to work on their tooth or whatever needs to be done. When the hygienist does hygiene, it creates an aerosol, and the aerosol fills the air. We don't know if it's exposing those droplets and making them airborne, because theoretically the droplets of the COVID virus, when one coughs or sneezes, is heavier than air and should drop onto a surface. But I don't know that, you know. So what we do is we open up a high-speed suction, and we suck the air right around the patient's oral cavity into this tube, and hopefully it'll go down into the sewer. So that's one of the protective mechanisms that we use. So in addition to that, when a patient comes, and I've been treating emergency patients, when a patient comes to the office, we treat each one of them as if they were a COVID-19 patient. We initially, when they come in, they sanitize their hands, and then we put a bonnet on their hair that covers the ears. We put a drape on, a disposable surgical drape. We take their temperature, and then we get them into the room where we put eye protection and sanitize the back of the throat, so that whatever's back there, we can have a fighting chance of the patient coming in and leaving unscathed by and not contracting anything in the office. And that's our methodology currently.
Okay, I think that
Wonderful.
you have really given us some significant information, even in terms of talking about COVID coming to the eye. And you are open, and we'll have this up on the site. Dr. Merrick, you are open if people have emergencies and need to come in, you are open for emergencies?
Yes, I am.
Okay. And I believe, what street is your office on, sir?
It's 260 West 139th Street, between 7th and 8th Avenue.
Okay.
But more importantly, not only do we need to wash our hands, but we also need to wash our faces, because the face is also exposed to these droplets or aerosols. And even though the bonnet covers the ears, it may not cover the neck and the whole of the face. So when I recommend that our patients not only wash their hands, but get that neck, get that face, scrub it down, make sure you do it for 20 seconds, because COVID doesn't like soap. It doesn't like it. It does not like Purell, any of those alcohols. It hates it. So give it some what for and stay healthy.
Okay, thank you. I think that you and all of us here today, and we are a creative people. And when Dr. McCurtis spoke about us getting creative, as a dentist, you looked at it, you've done your research, you know, you've gotten creative about it. Harlem Network News is born out of creativity. And we're all getting to know ourselves better. I have been a media person for the majority of my life, but this COVID-19 made me spring back into it and come to one of my passions, come to one of my dreams. And obviously working with the community, that is a passion for me. I care deeply about our community. I want us all to live. I want us all to be the best. And I think that this COVID-19 is bad and it's been a killer, but it's peeled off a lot of the layers that we already know about. It's made us get creative. It's made us get smarter. It's made us figure out how we all need to come together. And I'm just asking everyone that is watching this, everyone that is sharing with us, please spread the word about Harlem Network News. Churches, you are a pillar of our community. So I need all of the churches to reach out to all of the members. We have a lot of large churches here in Harlem. We've got small churches, but if the churches come together, this is another way that we can work. We have to work together. That's how we are going to win. We are going to, one of our next shows is we're going to have the ministers come on. We're going to have some ministers from some of our large churches like Abyssinia and Convent and, you know, for spiritual medicine, as well as FCBC. We're going to have, and some of the smaller churches, the AME, we want them all to come together because this is how we can win. And as Dr. McCurtis also touched on, we are a spiritual people. We are a people of faith. Very, very critical. You know, so we have many questions that are here. We want to get to those questions. I also just want to give a shout out, as they say, to Harlem Hospital. We were hoping, and they are so busy, we were hoping that the CEO of Harlem Hospital, who is a young African-American woman, and she is doing an amazing job. That is Miss Ebony Carrington. And to all of the chief of medicine at Harlem Hospital, we were with them on Tuesday, and the community, 3 organizations did a soul clap for Harlem Hospital, and it was incredible. We have footage on our website. You can go to our YouTube, but it was the Street Corner Resources with Aisha Sekou. It was Stephanie McGraw with WARM, which is an organization for domestic violence. You can reach out to her because that has been another stress that has come out. And we also have a Reverend Bristow, Kathy Bristow, who is actually doing counseling at Harlem Hospital. If they need to call a counselor, all of the workers there can get a 10-minute call so that they can help with some of the stresses that they're dealing with. And I know that the doctors and nurses, there is that stress. We had the incident at Columbia Presbyterian, which we all know about. But one thing that I did see when we saluted the Harlem Hospital, we had African drumming. They were all dancing. We had the fire department. We had the police department. There was a caravan. But Harlem Hospital, doctors and nurses, they were Harlem strong. I mean, as far as I'm concerned, they were walking as if they were Harriet Tubman. They were like, we got this, we got this, we got this. And they even were creative. One of the ICU nurses, she had made a leather mouthpiece, and she had a leather gele to go with it. And I was like, how you doing? She said, we got this. So that was very, very comforting. And they also shared, which is critical. We were like, what do you need? You know, do you have this? Do you have that? The PPE? They were like, we have everything. The community brought it to us. So we're going to begin to close now. I'm going to give it back to Dr. Michelle. Yes, and we have many listeners all over the world. They're listening to us in Africa. They're listening to us in Costa Rica. They're listening to us in Jamaica. You know, we are a people. Dr. Fergus, what's your country?
Oh, Montserrat.
Huh?
Montserrat.
Montserrat, they're listening to us in Montserrat. They're listening to us all over the world. This is the way, and Harlem, all the Harlems of the world. They're in Vegas, they're in Arizona. So without further ado, I'm gonna give it back to Dr. Michelle. We thank everybody for listening. We will be coming back. And oh, I'm sorry, Dr. Fergus is gonna say something to kind of close us out. But I also wanted to share that tune in, follow us, because next week, we're going to have back the public officials. We had all the public officials last week. We had our Congressman Espion. We had our borough president, Gail Brewer. We had our state senator, Brian Benjamin. We also had our assembly member, Inez Dickens, and we had our assembly member, Reverend Al Taylor. And that was very significant. It was the same kind of information, and very, very critical, especially to do with the payment protection program, because I'm going to say this on the air because I want it to be known that they told us we could go to the, you know, smaller banks, and Carver had it, and Banco Popular had it, and they said Grace Church had it, and Grace Church said they don't know anything about it and they didn't have it. So I want this investigated. I want the public officials to investigate what's happening, what banks actually have it, and what's actually going on in Harlem. We need to know that, because there's a lot of stuff being said, but what's being said and what is actually happening is not the same thing. And knowledge is power. So Dr. Fergus, and please donate, donate, donate. And once again, we want to thank the Osei Ruby Foundation for donating to us. He has been sharing those donations with many other community organizations. He's given to Lincoln University, which is one of my alma maters, the first Black college. So share. Thank you, Dr. Fergus. Thank you.
Oh, thank you. Well, again, I'm thanking you for inviting me to be part of such a powerful panel. I know there are a lot of questions that we can't get to, but maybe you can post them on your website with answers. And I'm sure as you go do this program every week that, you know, more and more questions will be answered. It was great. It was very great for me to be a part of such an illustrious panel. I enjoyed hearing everyone speak. You know, it's good to hear the insight from the mental perspective and what's happening in practices such as Dr. Merrick, and of course, you know, Dr. Alexander with her overall fantastic overview. Just one thing struck me. I know there's a lot of desperation out there. What's going to happen? The virus may likely come back, and I'm sure Dr. Michelle will touch on that. But what I can tell people as a sense of hope, and this is what I tell my patients as well. You know, there was an article that talked about why is it that some countries are so devastated by the virus and some are not. Some of the things they pointed out, for instance, in Japan, South Korea, and other places like that, is that people, whenever they were sick, they always wore masks. They always do physical distancing. In Japan, they bow, you know, some people don't necessarily shake hands, etc. So I think that, you know, things are going to change as we know it. But again, just be very cognizant that there are invisible potential germs out there at all times. So best practices, I think Dr. MxCurtis puts it well. It's not social distancing. You need to interact and talk to people and reach out and be well, but it's the physical. You know, we know that within 6 feet that there's an issue. You know, washing the hands and using the appropriate sanitizers and disinfectants, because as Dr. Merrick said, the virus is susceptible. If it doesn't have all of the layers, it's gonna break down, right? So if you happen to have it on your hands or something, and then you use the appropriate sanitizers and cleansers, it's gonna go away. If you wipe down surfaces, etc., it will go away. So, or less likely to be spread, I should say. So, I mean, we can combat this. To the young lady who has her business, I would say, follow what the governor, tells you. But once you go back out, and that will happen, is to just assume that people can potentially affect you and protect yourself. I believe people are going to be wearing more masks, and they're going to have maybe barriers to protect themselves. But the time will come when people are going to be able to interact, but interact safely. So I'd like to end with that. So thank you very much again.
Okay, thank you. And I'm going to have our incredible co-host and just caring community person, Dr. Michelle Alexander. You never call her that she doesn't. So just a brief closing statement. And I want to thank you, Dr. MxCurtis, very insightful. And Dr. Merrick, that was amazing. It was very, very much on the point and creative, and we learned something. We got to wash our face. We got to wash our neck. Thank you. Got to cover our eyes. I have some goggles I got from the store, and I wear those outside. So there you go. Dr. Michelle, thank you.
So the thing I want to just say, thank you, Terri, once again for getting this together, because I do know that when people who look like you are more likely to listen to them, and you more likely to trust them, because, as a community, we have always been a little leery of the medical community, given the history of how our community has been treated throughout the years. But I do want to end on a message of hope. And I want to tell all of my fellow colleagues, I want to thank you for providing some great information. It was done in a way that I personally received some very good information that I will find very, very useful. The thing that as I said, I do want to talk about some hopeful things. So the first thing I'm going to say, even when things are down, there's a saying that says that it's in the valleys I grow. And this is the time for renewing yourself, for looking inward, and for basically this is the time to make yourself over, to give yourself new meaning and new direction. And if anything that we have learned from this is that as a community, as a Black community, that we need to take care of each other. It is key to our survival. One of the things I will encourage everyone to do, because one of the things we know with this virus is that it looks for the weak, and it looks for when you're under attack. And as a community, we've been under attack. But if you could eat healthy, meaning a mostly plant-based diet, Dr. MxCurtis already talked about inflammatory foods. So I will add to the sugar and the alcohol, red meat, because that is one of the highest inflammatory foods around. It's actually a primary carcinogen. I will tell you that eating green foods, lots of citrus fruits. We know that vitamin C is a great fighter of all viruses and bacteria. It's a major immune booster. And we also know that things like ginger and garlic and lemon are all immune boosters, and turmeric is a anti-inflammatory. So these are some of the things that you can add to your diet.
Okay, I'm not sure. Okay, here she is. Thank you.
Yeah, I know that was, I thought I put on my do not disturb, but anyway. So ultimately, I will tell you that you need to look at your sleep hygiene, drink lots and lots of water, exercise, volunteer, and an attitude of gratitude is key. If you are thankful every day for just waking up in the morning, that is a major way to start your day. And then ultimately, as already been said, prayer changes things. I believe in that sincerely. I pray daily, continuously. His praises will always be in my mouth. So I know that there is a Savior and that he is looking on me. And I know that he will take me through the storm. I trust God. And I think that that's key to being healthy. So with that, that's what I'm going to end with. And I wanted to thank you all for being here and being such wonderful panelists. Thank you.
Yes, yes, thank you so much. And we're going to close. This is Terri Wisdom coming to you live from Harlem. for Harlem Network News. And I must say, we are indeed a powerful, powerful, powerful people. So let us continue, and we will have the doctors back as things change, but we really, really, really appreciate it. It's very significant, and this is our community. So thank you very much. Go to harlemnetworknews.com, find us on Facebook, go to YouTube, and please encourage others to come to the site, to donate, send in stories. This is what is going to keep us going, okay? We are survivors. Thank you. We need you. Have a great day. Stay strong, Harlem. Thank you.
Thank you.